We actually have studied for years the different types of disease that you have, that you see in pandas. And one of the types that we're most familiar with is the one that is most similar to rheumatic fever, which is pandas with the little choreiform movements. And they have tics and OCD also. But these choreiform movements put them in a class that is similar to Sydenham chorea, and it is a very acute onset. And so these children have antibodies against the dopamine D2 receptor, and that's about 15% of the cases. A larger percentage are more chronic because they've had it for over a year. And so in most of those instances, those children have antibodies against the D1 receptor and may not have antibodies against the D2 receptor. And so it separates those two, the acute and the chronic. And because it's a dopamine receptor encephalitis type of disease, because that's what's causing potentially causing some of the inflammation, then those may in some patients be in a particular ratio that causes the different types of symptoms that you may see in the disease. And then also in tics, we found that the antibodies to tubulin and lysoganglioside are highly elevated, oftentimes in tics, such as Tourette's, or tic, if a child has a lot of tics. And that's, so far that's about how we have it segregated. Means that your other antibodies have dropped off. They may have been elevated at one time, like in the acute stage they may have been highly elevated, but still you have antibodies that activate the neuronal cell line and affect your brain. And so then you will have a positive CAM kinase because the antibodies are binding to the cell line. And that's the beauty of that test, is when the others miss detection of an antibody, then the CAM kinase detects signaling by the sera, whereas the others will not. And oftentimes you can have a very highly elevated CAM and the others will be negative, particularly in those cases that are more chronic. The CAM is very important, and it goes down with improvement. So it's gradual. You have to remember that as the antibodies go down during improvement, that antibodies are just not cut off instantly, that when you have this instant improvement, it's likely to be that IVIG or plasma exchange helps close the blood-brain barrier so the antibodies cannot get in. It's a very complex disease. You've got a blood-brain barrier that as long as it's open, the antibodies can get in. But if you close the blood-brain barrier, you can still have the antibodies in the blood, but they won't be affecting the brain.